I think, Sneha and I, during our session, will cover precision medicine, liquid biopsy, pharmacogenomics, CAR T therapy, clinical pathways, and virtual navigation. So quite kind of the spectrum of topics. And we're going to cover both clinical as well as managed care considerations. And I think that brings to your question of like, how do we manage new therapies in the face of rising costs? And things I would want, our audience to remember is that these new therapies bring great innovation and they also bring better efficacy and lower toxicity for many patients. And although they might bring a high cost with initial approvals, we might make some of that up in terms of better outcomes for patients, as well as lower toxicity that might need to be managed. So, really balancing that, new innovation, new efficacy with cost and long-term models, I think is really important. Some of the topics that Sneha and I are going to be talking about, we've been talking about them for like 2 decades. And so some people might say, well, what's next or what's hot about these topics? And I think, a takeaway for me is certainly we might have introduced precision medicine 2 decades ago, but our industry and the entire healthcare ecosystem is still trying to solve on how to best execute that so it reaches patients and actually does improve those outcomes. And so, these topics might have been around for a while, but there's still lots changing as like the science evolves and we learn more and we get more experience.